now like to acknowledge the delegation from Pakistan who are here in relation to the Indus Hospital. This is headed by Dr. Bari Khan, who I'd like to welcome to the stage now to give us a brief presentation regarding the Indus Hospital. Please welcome Dr. Khan.
Assalamu alaikum wa rahmatullahi wa barakatuhu. First of all, I am thankful to Pakistan Business Council for providing me an opportunity to share with you a success story from Pakistan, the Indus Hospital. Pakistan spent about 0.9% of its GDP on health, which is very meager. We have a youth population of 189 million. We have about 9.6 doctors, 4.9 nurses, and 6 beds per 10,000, which is very minimal as per standards. I've been trained in a public sector hospital where every patient comes with a story, selling the goats, their goats, buffaloes, houses to get treatment. The public sector hospitals are in pathetic conditions. There is only bed and doctor available. Rest, it is out of pocket. And the private sector is too expensive. What to do? Life is not about waiting for the storm to pass, rather it is about learning how to dance in the rain. So we had a dream, and dreams are not that we see while we are sleeping. Actually, they are which keeps you awake. So Indus Hospital is a hospital which provides quality care free of cost. Historically, we started this hospital in 2007 as a 50-bedded facility providing quality care free of cost, indiscriminate health care to everyone who comes there. And our vision is to create an excellence-driven, comprehensive, passionate care, free of charge to all. And our motto is to just please Allah subhanahu wa ta'ala. The basis of Indus Hospital is a firm belief in Allah subhanahu wa ta'ala, which appears impossible. But for Allah, it is nothing. It just always be and it happens. Kun fayakun. It's a cashless hospital to the extent there is no cash counter. It's a paperless hospital. The first hiring was done was the software engineers, and the software was developed in-house. It's indiscriminate and accessible. We have 3 areas. We started with 1 hospital in 2007. Now, alhamdulillah, we have 12 hospitals across Pakistan. We have 4 hospitals which are managed, funded, and built by Indus Hospital, Indus Health Network. And we have about 8 hospitals which we are running on private-public partnership. Within 5 years of our existence, we were approached by the provincial government to take over their hospitals. The first one was taken in Muzaffargarh, and then now we have 5 hospitals in Lahore, 1 in Multan, 1 in Muzaffargarh, and 1 in Sindh, which is Badin. Overall, we have about, at this moment, because there's one more new hospital which came into the network, and now we have about 1,550 beds across Pakistan. Apart from this, we also have some key initiatives. We have the best blood center which provide quality blood, and we have about 77,000 registered voluntary donors, which is replaced. Till 1981, we used to have professional donors who were addicts, drug addicts. And a healthy person can give blood once in 3 months. But these addicts used to donate, or rather sell their blood twice a week. They had everything in their blood except blood. That is hepatitis, HIV, malaria. So we started this regional blood centers, And at this moment, we have 3 regional blood centers, one in Karachi, one in Multan, and one in Bahawalpur. And the 4th one will be operational by mid-August in Jamshoro. In collaboration with International Committee of Red Cross and Shell Foundation, we have established physical rehabilitation center in Karachi, Lahore, and Muzaffargarh. We provide artificial limbs, upper and lower, to amputees. These patients are lifelong patients. They need, when they are child, if there is a child, he grows, so his limb has to be replaced. We have the largest children cancer services. It is an 85-bedded hospital, and up till now we have treated almost 16,000 patients, all free of cost. Other key initiatives are disease-based, that is Pelakadam, diabetes management programs, rabies-free Karachi. We get almost about 25 to 30 cases of dog bites by stray dogs. And if it is not prevented, not given the injections, they will all culminate in rabies, which is almost 100% fatal. Then we have a disease-based outreach program. Pakistan is number 6 as far as the load of TB is concerned, and we have been selected as the principal recipient for eradicating tuberculosis in the country by Global Fund. We are managing almost $80 million grant from Global Fund WHO. Similarly, we have a national program of malaria eradication in KPK and Balochistan, 18 districts of. So as a network, when we started, our annual budget in 2007 was $1 million. Alhamdulillah, now it is $120 million. We have 12 hospitals across Pakistan. We have 3 rehabilitation centers, 3 regional blood centers, and we have primary healthcare program in almost 41 districts of Pakistan. And to achieve this, we have 8,000 employees across Pakistan. And we treat almost 60,000 patients per month. Since 2007, more than 6.7 million patients has been treated. And as I told you, the operational budget for the current year is $120 million. We are a Section 42 company with board of directors, with Yunus Hashim Ghali as the chairman. We are audited by PricewaterhouseCoopers. We have legal tax advisors at Indus of Pakistan. We have international chapters registered in Friends of Indus Hospital USA in Canada, UK, and we have a registered charity in IHC, UAE. In 2016-2017, about 64% contribution were from the individuals, 24% from corporate, and 12% from government grants. And out of this, 46% were non-zakat and 54% was zakat. And the good news is 92% is collected within Pakistan, and only 8% is from international funding. Within months of its establishment, we realized that 150 beds in a metropolis of 25 million, it is a micro drop in an ocean. Fortunately, we had 20 acres of land, and we had to expand. We got a master plan prepared by a CPG company from Singapore, which are well-renowned master planners in healthcare. After reviewing our last 10 years' data, we realized about 53% of our patients coming to a tertiary care hospital doesn't need to be in hospital, and they should be treated in their doorsteps. So we are now making primary healthcare programs across Pakistan, and by 2018 we will be having 22 independent sites of family medicine clinics, and by 2020 about 50 independent sites. The Korangi campus, which is at this moment is about 300-bedded hospital, inshallah, by the end of next year or early 2020, it would be a 1,000-bed facility, and by 2024 it would be 1,800-bed facility. During this tenure, we experienced that the major challenge is not the money or the building. It is a human resource. Sustainability of an organization is dependent upon the human resource, and a human resource which is passionate, which is compassionate, and we decided to make our own nursery, and inshallah by next 2 years, we have a running school of nursing. We produce about 150 nurses a year, and inshallah in 2 years' time we'll have Indus University of Health Sciences, where medical college, dental college, college of physical rehabilitation and pharmacy will be starting in the next 2 years. Similarly, we have started a hospital in Lahore. It will be a 500-bedded facility, and about 200 beds will start by the end of this year, inshallah. When we were starting, we were about 99.9% people told us that you may be able to build it, but I don't think so. You will be able to run it free of cost. We were given a month, max 6 months or a year, and that you will be charging. Alhamdulillah, we are into 11 years of existence. Not a single patient has been refused treatment because of lack of money. Together, inshallah, we can make a difference. And in short span of 10 years, what we have achieved, it is just because of the blessings of Allah subhanahu wa ta'ala and the contribution of Pakistani people from Pakistan. I'm proud to be a Pakistani because I've seen the nation to be united whenever there has been a natural disaster, be it an earthquake of 2005 or a flood of 2010 or 2011. This was just a brief presentation. If you have any questions, I'll be more than happy to answer. Thank you.
So thank you very much, Dr. Bari Khan. And again, a thank you to all our speakers tonight and all our distinguished members who joined us this evening. We hope you found it informative and valuable. We look forward to welcoming you to our next event. And as you're well aware, dinner has been served. So thank you once again.